Alright, let's do this. Let's get into joint health and treatment. In this video, we will explore the essentials PTAs need to know about osteoarthritis, from what it is to how you can make an impact on the lives of millions. Let's study osteoarthritis. Osteoarthritis is a common chronic condition that occurs when the cartilage in our joints break down over time. The exact cause of primary osteoarthritis is idiopathic, which means it typically occurs spontaneously or for no apparent reason. This degenerative process is often a result of putting too much pressure on a healthy joint or putting normal pressure on a joint that is already abnormal. As the cartilage and the joint space diminish, new reactive bone may form around the edges and underneath the joint. Osteoarthritis can be divided into two categories, primary and secondary. Primary osteoarthritis is related to the natural aging process and is more common in older individuals. Secondary osteoarthritis, on the other hand, occurs due to other underlying conditions, such as trauma that negatively affect the cartilage and bone in the affected joints. This type of osteoarthritis is more prevalent in the younger population. There are several risk factors for developing osteoarthritis, including age, obesity, trauma, infection, repetitive microtrauma, genetic factors, inflammatory arthritis, neuromuscular disorders, and metabolic disorders. Man, that's quite a list. Let's go over the presentation for osteoarthritis. Possible locations for arthritis include the finger joints, or the dips and pips, as well as the knee, hip, and spine. Patients will notice a decrease in their range of motion, along with a grating sensation or a sound caused by the rubbing of the bone on cartilage within the affected joint. This is known as crepitus. They will also experience a deep and persistent joint pain that worsens with prolonged activity and use. Initially, patients may only experience pain during physical activity, but it can be relieved by rest and responds well to pain-relieving medication. Depending on the joint affected, patients may exhibit an altered walking pattern, unusual movements, and muscle wasting. There may also be an increased incidence of strains and sprains around those joints affected by OA, which could be due to the ligaments and muscles needing to assist in the support of the joint. Osteoarthritis treatment approaches vary depending on the symptoms and the specific joints affected. First, the non-PT side. To alleviate pain, pharmacological interventions such as acetaminophen or other NSAIDs are commonly used. Glucocorticoid injections are also commonly used, but they should be used sparingly due to the potential long-term negative effects like osteoporosis they have on the joints. So let's go over to the physical therapy side and what this means to us as PTAs. The goal of physical therapy should be to maintain joint motion and flexibility. This often involves posture retraining, evaluating the patient's work site, general strengthening exercises, endurance activities, aquatic therapy, and engaging in functional activities. When it comes to home care, the patient will typically continue to perform the exercises that they can tolerate within the clinic. This may include strengthening exercises, endurance activities, and the use of supportive or assisted devices if they need them. In summary, osteoarthritis treatment takes a multifaceted approach tailored to the patient's symptoms and affected joints. Educating patients about their condition and providing them with the appropriate interventions such as medication, physical therapy, and home care is crucial to their recovery. Finally, the outcomes. It's important to understand that physical therapy does not have the power to alter the final outcome of osteoarthritis. It can, however, be immensely helpful during the periods of worsened symptoms or during their flare-ups. Osteoarthritis is a chronic and progressive condition, but physical therapy can aid in reducing its impact and promoting patient autonomy in manageable daily tasks. Over time, the pain associated with osteoarthritis typically intensifies. There is a possibility of it stabilizing. In cases where conservative treatment proves ineffective, joint replacement surgery may be considered. And that's just about everything for osteoarthritis. Have you treated osteoarthritis? Any tips to help study and remember it? Leave them down in the comment section below. We also have a podcast where we release episodes twice a week, so be sure to check out our links in the description below. And until then, we'll catch you next time.